I'm delighted to introduce this new piece of research looking at competency and disengagement. We originally asked Professor Zubin Austin from the University of Toronto to produce a literature review looking at the whole area of competence and what competence means. In the first part of the report, Zubin is exploring these ideas and constructs and really challenging us to think differently about the meaning of competence. Competence is about team working, it's about emotional intelligence, it's about the ability to stay engaged in your practice. And then the second part of the report is an empirical study, a qualitative study, and the findings from that very much reinforce Zubin's observation that competence is very much more complex than perhaps some of our frameworks would suggest, and that the triggers for people becoming disengaged from practice are also very complex. I think that the key message for us as a regulator is that we need to have more understanding, we need to build the evidence base around this whole area of competence and engagement. And secondly, that we need to be encouraging people to have conversations about it. There's a lot in the material from the interviews, the qualitative study around ways of preventing people from becoming disengaged. So looking for the early warning signs of disengagement and trying to put mechanisms in place to support people, to provide the right structures, to provide the right kind of mentoring, opportunities for more conversations, in order to build self-awareness, to build resilience, and hopefully to prevent small problems from becoming big problems later on. What we want to do next is to share this work as widely as possible, so through our workshops, through our events, through our conversations with government, with employers, with professional bodies, with unions, with educators, as well as with registrants and members of the public. We want to share this as widely as possible and to generate debate and discussion about the triggers for disengagement and ways of preventing disengagement from happening in the first place. So that's really key for us, and it has been throughout our research program. It's about generating conversations, stimulating debate, and through that to try and bring about change and improvement in health and care.